with this legislation, we will improve quality, we will lower cost, we will expand coverage, and we will retain choice. If you like what you have, you can keep it. If you like your doctor, you can keep your doctor. But the fact is, in order for all of that to happen, we must pass the legislation because the present system is financially unsustainable. Individuals can't afford it, businesses can't afford it, our economy can't afford it, and the upward spiral of medical cost is taking our deficit to a place that we have a moral responsibility to protect our country from. And we have that obligation to our children.
Older women can be charged right now up to 11 times more for coverage. Many older women just can't afford those premiums, and they're forced to count the months and the years until they can qualify for Medicare. I hear from those women in my office every week and be assured of getting the care that they need. Again, our bill provides a solution. First, we ensure that older women and all individuals can buy coverage at group rates. And second, we limit age rating to 2 to 1, making coverage more affordable.
As the former executive director and founder of the National Network to End Domestic Violence, I want to share with you that each year in this country, nearly 2 million women of all races, incomes, education levels, religious backgrounds experience domestic violence. 1 in 4 women will be a victim of domestic violence in her lifetime. It's shocking and inexcusable that in 8 states, these victims are told that their experience of domestic violence is a pre-existing medical condition. It's imperative that we enact health care reform that eliminates the practice of categorizing such things as pregnancy, cesarean sections, and even domestic violence as a pre-existing condition, and as a result, often denying coverage. If left unchecked under these discriminatory practices, the insurance industry would effectively exclude coverage for millions of women. This is a shameful practice. It must stop, and it will stop when the President signs into law this year health care reform for all Americans.
I have been diagnosed with having multiple sclerosis. That happened back in 2003, that diagnosis. But like thousands of other Americans who are living with chronic illness, with autoimmune diseases, with MS, I'm not defined by it. The insurance industry tells us that because women are 2 to 3 times more likely to have multiple sclerosis, 10 times more likely to have breast cancer, because 55,000 more women than men have strokes every year, they can rate insurance based on gender. And the decisions that they are making are not only unfair or immoral, frankly, they're bad public policy. They are un-American. They're bad public policy and costly, because if women with MS, men with MS too for that matter, can get the care, can get the treatments, they can delay the onset of disability, and frankly, I think it would cost the public a whole lot less and cost the insurance companies a whole lot less. We didn't have people proceeding into wheelchairs or into nursing homes, but were able to live healthy and active lives, pursue their dreams, pursue their careers the way I have.
Right now, 79% of all women buying private policies are not covered by maternity coverage. Now, that is ridiculous public policy. And it helps women of all ages, Medicare age and younger women. And let's face it, when we talk about poor paying women, people at the bottom of the totem pole that cannot afford health care, who is that in the majority? That is women. And this helps make it affordable for women of all classes and all ages, and it eliminates all kinds of subtle discrimination that affects women negatively.
If you're fortunate enough as a woman to have insurance, you're going to pay 68% more of it. Why? Because you have a pre-existing condition. You're an actual, former, or potential mother. I don't know how you escape those statistics, but the insurance policy will either charge and rate you 68% more, Or more likely than that, 79% of those private insurers will not insure you for pregnancy and maternity benefits at all. We need this health care reform to bring fairness to the insurance market, and particularly for women. And let me tell you, the hand that rocks the cradle rules the world.